Shalom. Welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabad House of Delmar, together with my co-host Mark Ronich of Statewide News Service, jbiztechvalley.com, and now, as you could see, columnist for the Jewish Press.
Right, and I have a column called Albany Beat, which is monthly, and we talk about how government relates to the Jewish community, or doesn't, as the case may be. And our guest today is Glenn Liebman, who happens to be Jewish. And welcome to the Jewish View.
There you go. You fit to the Jewish
There
View.
we go.
And
There we go.
You're
Very proud to be Jewish.
You're the head of the Mental Health Association of New York State.
Correct.
So we're going to talk about mental health today.
Oh, great.
Mark, has had something for you over there?
I have some personal knowledge of this, yes.
All
But
right, good.
I just wanted to know, is mental health more prevalent now because we're categorizing more illnesses that we didn't characterize as mental health under the mental health umbrella?
That's a good question, Mark, and I think you're right. I think it clearly, there's always been mental health issues there, but I think they've become more visible as people have become, there are more diagnoses, people have become more outspoken, not outspoken enough in terms of mental health related issues, but you're clearly right. It is more pervasive. It was always there, but now people are at least talking about it more publicly.
But, it goes the other hand. There could be two major factors. Maybe it's our culture. It's just, even though we have so many conveniences, the washing machine, you hit a button and the woman used to scrub and et cetera, et cetera, et cetera. But, there's a lot of stress in today's society.
Absolutely.
You can imagine 100, 150 years ago, I could only imagine also, but you're on a farm and, and watching the grass grow and feeding the cows. You didn't have that stress, and the news are shooting at you now, not let alone the television news, but now you have the iPad, the latest thing. There was a bomb here across the world.
Yep.
And the stresses of society are incredible compared to 100 years ago.
No, you're absolutely right. And the other thing is, which you brought up a good point, the other thing is, especially because we've seen such a spike in adolescent mental health related issues.
Why is that?
Well, one of the reasons is social media. You're absolutely
Really?
Yep, it's absolutely true, because the social media, again, there are a lot of great things out of social media, but there are a lot of not so great things out of social media. And it used to be, if you were bullied as a kid, right, there was actually a time when the bullying would end. You'd go home and you wouldn't be bullied again till the next morning.
I never thought
Here
of it
in
that
social
way.
media, you could be bullied 24/7. I mean,
I never thought of it that
Well,
way.
yeah, I
It's
mean, there were a
interesting.
few suicides because people were bullied on the internet and they jumped off bridges or killed themselves in some
It's
fashion.
very sad. And the other thing with social media is the isolation piece. You could be saying you're sitting home depressed, and then you're reading about all your peers and everything. They're at this party, they're at that party, they're doing wonderful things. That's even going to make you more depressed and make you feel more isolated and more out of the...
Inadequate.
Right. And more out of the social loop of what's going on. So it clearly, you brought up a very good point. Clearly social media is one of the issues that we face.
Now, they always talk about, gun violence being associated with mental illness. Is there something where the SAFE Act would have any impact on that, or is that two totally separate things that you really can't control someone who has mental illness getting a gun and doing something, whether or not there is a SAFE Act?
Yeah. Well, I mean, we look at it a little differently than that. We basically say that people with mental illness are no more likely to commit, any sort of crime of violence than anybody in the general population. You look at this numbers, it's science, it's numbers, it's not stuff we're making up. You're 12 times more likely to be a victim of violence if you have a mental illness than a perpetrator of violence. More than that, only 4% of all murders that occurred in the United States, I think the numbers were from 2013, 2012, only 4% were committed by people with some sort of mental illness. So, mental illness by itself is not going to make somebody violent. I think you have to look at other factors too: a history of violence in the family, domestic abuse, substance, alcohol abuse. Those are things, and yet...
But people were saying, just to interrupt, but you say substance abuse, but sometimes the pharmaceutical companies, certain things, the antidepressants, and I'm not that familiar to give you any names, but they say they're on medicine, and the medicine, one of the side effects is to be so depressed or suicidal or...
Well, yeah, I mean, they have
violent.
they have the warning labels that talk about, suicide for somebody, taking a certain, could be a risk factor. Suicide could be a risk factor for somebody taking a certain antidepressant. But the other hand on that, to flip that around, is that basically for a lot of people, if you're not taking that antidepressant, then you're likely to be much more suicidal. You know, with depression, it's been shown, the studies have shown that the combination of antidepressants and talk therapy and an active lifestyle, you know, much more social lifestyle, are really keys to somebody, you know, getting over depression. You know, there are a certain percentage of people with depression who it's long-term and stays with them for many years, but most people are able to sort of move forward in their lives even with depression. And there have been enough, you know, actions over the years that have shown that people are really, you know, do better when they're living a much more active lifestyle, much more healthy lifestyle, have all kinds of wellness built into their life, and again, are maybe getting a medication, and maybe they're getting talk therapy as well. So those are all
It's
sort
an
of
interesting
positive
field.
things.
What's your background? And I mean, I know you're the head of the mental health field.
My background actually is very little to do with mental health. It's more on the political side. I was graduate student in political science at SUNY Albany, and I worked for then Governor Mario Cuomo. And then, you know, I worked there for many years. I ended up becoming a sports writer for several years. That's a whole nother story. But
I like to hear that story.
yeah, but then, you know, I always wanted to contribute, and then I had an opportunity to work for another mental health related organization.
What did you do in the first Cuomo administration?
My title was confidential assistant. I worked for a person who was worked very closely with the governor, and I did a lot of briefings, planning schedules, you know,
So you
helping
worked
the
for
speech
Drew
writers.
Zandelli.
I worked for, actually, the person I worked for was Elaine Ryan.
Elaine Ryan?
Yeah,
Oh, okay. I
Yeah,
know
back in
Elaine.
the day,
Yeah, yeah.
Elaine was great.
You know
Still
my
is
friend
great.
Jerry Fortinsky? Does that name ring a bell? No?
No,
Okay.
I don't. That's,
He was
yeah.
down there working with Drew. Okay.
Yeah, no, Elaine was wonderful. Certainly we know Drew and the
Elaine,
good work
yeah.
that he did. But yeah, Elaine was great.
So you
then
ended up
so-
in the mental health?
Yeah, so I
then
ended up in
so
the...
this opportunity came along and...
Yeah, I was with another organization at the time. I became the Alliance for the Mentally Ill, which is now NAMI.
Uh-huh.
I was there for several years, the public policy person. I became their director. I was the director for several years. Then I went into government for a while. And then I came out about 11 years ago to become director of the Mental Health Association.
Right. Well, that's where I know you. I have this idea of you always being with Mental Health
Yeah,
Association.
Yeah.
You know. You're
yeah,
just...
I've been
What
there a
is
long
the
time.
function of this association? What are you
Well-
trying to advocate for?
Well, we advocate. First of all, we're a statewide organization. We have 30 affiliates throughout New York State and in 52 different counties.
And you're a state agency to get money from the state?
We are a state. We're not a state agency. We're not part of New York State
Right.
government. We're a separate entity. We're a 403B, you know, not-for-profit agency. And what we do is we work with our affiliates around the state. We ourselves do not provide direct care. A lot of our members provide direct mental health care in their communities. What we do is we have, you know, we work with the state. We have state contracts, but we also do a lot of advocacy and public education. So a lot of what I do personally is, you know, I obviously I have to run the agency, but I'm also very involved. Doing advocacy is my passion, and that's sort of what I.
So you're on the Jewish View to
What's
educate
what's
the
the
public.
budget that you for your organization?
Our budget, it's about $1.5 million.
Yeah.
Yeah.
And is any of that state funds or?
Some of it, yeah.
Some
A
of
good
it.
percentage of our funding is state funding.
That's
Yeah.
no conflict of interest that you...
No, we've never, you know, to the state's credit, and, you know, we've taken some stands strongly against the state in some areas, and there's never been any sort of
Retribution.
backlash. And this has been, you know, ongoing now for what? So I've been there 12 years, four different administrations, so. yeah,
What
we've
kind of
actually-
things that now in the current time are you advocating for mental health?
Well, we're doing a lot of, you know, we're this whole Medicaid managed care thing moving forward, which is, you know, there's a lot of complexity there, and we're certainly very involved with that. But in terms of public interest and public education, right now we have a mental health tax checkoff bill, which basically there are 10 checkoff bills in New York State right now, if you look at the New York State income tax. We are advocating for mental health public awareness tax checkoff bill. It would be the landmark, it'd be the first of its kind in the country. And we've been advocating for several
To
years.
make some more
and the
money.
legislature actually passed it this year. So it's
Waiting for the
waiting for the
governor's
governor to
signature?
sign it.
And this
we're
would
very
be that
hopeful.
when people pay their taxes, if they feel that they're not paying enough, they could check the box and more money could go to you?
Well, it doesn't go to us, it actually goes to the state, goes to the State Office of Mental Health
Uh-huh.
for a public awareness campaign.
Allegedly.
So, yeah, well, that's why we're advocating for it, so let's
But
hope
there's no
that's what's going-
lockbox.
Right, there's not a lockbox, but the language of legislation over tax checks has changed dramatically in the last year, and I think they make it much stronger. There's all kinds of audit, all kinds of audit pieces that are involved. So we're hoping that it becomes essentially a lockbox.
One of the things they say about mental health, and I guess it's because what you brought up before, obviously makes big headline news. One, you say in Yiddish, I'm a suganer, a nut starts
sure.
killing
Yeah,
people.
that person's
Oh,
Meshuggah,
what are we going to do?
Right.
I know what you're saying. Sometimes the headlines obscure, and that's what you're saying also. It's really not 98% of people killing people or
Right.
came out of the mental
Exactly.
institution. But then again, on the other hand, they're saying maybe these people should be institutionalized. What do you feel about?
Well, I feel that, there is a need for hospital beds. I don't think there is an overwhelming need for hospital beds. I think there have to be more hospital beds, and less so about hospital beds, but more so crisis stabilization beds. So say like, local, like Samaritans here, Ellis has like these crisis beds where somebody can go in and maybe just stay for, get their symptomology, normalized, become, start feeling better, and not moving people out quickly, but people shouldn't be staying in hospitals for long term, and we should get the appropriate, get them on the appropriate medication, get them on the appropriate supports, and make sure you follow through. That's the key thing. It's the follow up. A lot of times people go into crisis service, then they start calming down and doing better because people recover and move forward in their lives, and yet what's the failure of the system in many ways is there's not that aftercare that's necessary.
That's
And
interesting.
frustrating.
That's good. It's just you say we, put a Band-Aid on the problem, but you got to have the follow-up.
Right,
in a lot of
right, and that's
situations.
where our members are really good. I mean, obviously I'm touting my members, but it's true that our organization and other nonprofit organizations as well have community-based services where they can help engage somebody and help them get into a program, help them get housing, help them get the necessary supports that they need to live productively in the
So are
community.
you talking about psychiatric centers when you talk about mental health, or are there other types
No,
of
in the community. We are,
residential?
most of our members are residential. Most of our members are community-based providers. So our goal is to keep people in the community.
But
to
you were
take
talking
people-
about hospital beds, you were talking about crisis
Well,
centers.
yeah, exactly.
So you're
That's
talking-
institution, that's the
Right, so you're talking
institutional
about
side of it.
psychiatric centers, or you're talking about like Albany Med might have a crisis
Correct.
center?
Correct.
Or
Those, yes.
which
Some
way?
of the,
Which-
well, no, there are psychiatric hospitals like CDPC here in Albany, and then, Capital District Psych Center, and then there are some hospitals that have mental health beds.
Right.
Albany Med no longer has it. Ellis does, Samaritans does, I think, in the Capital District.
It's interesting
And-
because I know that people medically, that a person, you go to a doctor, you're fairly healthy, you wait the next day, I have a flu, or there's emergency room. So it was a big thing to have urgent care, which was a little in between. Hey, it's
Right.
Sunday, the doctor is not open, but I'm really sick, but I don't have to be in the hospital. So it's something that I think that
Yeah, no, actually, that's a
just-
good point, Rabbi, because they're talking about, one of the things they're talking about in terms of the future of the system is making more of the mental health related to urgent care kind of settings.
It's
That's a good
interesting,
one,
yeah.
yeah.
Another big problem is just, I'll tell you why I'm very involved in this. Actually, a number of years ago, the CDPC, as you say, Capital District Psychiatric Center, had a
Right.
whole session for clergy.
Okay.
Well, they're not there to just teach clergy, but they got us in there, all kinds of different religions, denominations, and they said, why did we call you here, or why are we trying to educate you? Because we found out that before a person checks themselves into the hospital, the number one person that they see beforehand is clergy. So we want to educate you because you're the urgent care in a way
Right,
before.
right.
And it's interesting. I'm just thinking even afterwards, people are out. People are lonely. That's one of the things that I've found also. And who do they talk to? The
Exactly.
doctors say, well, I'm done with you. I gave your medicine, goodbye. And, a clergyman's always open to...
Yeah, no, it's true. And the issue that doesn't get talked about enough is the issue of isolation. And that's where the stigma comes in. That people
Isolation
start-
or loneliness? Is that the same thing?
Both, because what happens, and this is where we're fighting so hard for a tax checkoff bill, is because there is so much stigma. Even though it's better than it was, there's still so much stigma related to mental illness. And you see it with the youth, for example, or like people like say, like it's like a leper or something like that. Like, oh my God, that that kid's got some sort of mental health issue. Stay away from him. And that unfortunately is pervasive in the adulthood too, as you move up the ladder. And people, even though attitudes are better, there's still so many people who are like, oh God, that person, as you said, Meshuggah, that person's Meshuggah, I don't want to have to deal with that person. Like, that's stigma related.
That's terrible.
Yeah.
I know even in my synagogue, people you could see they're a little, let's say, odd. I mean, they're off, something's wrong with them. They're not dressed properly, you see there's something. And I invite them in, and people have come to me and say, Rabbi, you need these kind of people here. And, I says, well, I'm open to every person. That's the way I am, And that's part of my teaching, too. You don't have, everybody should be open to every person, not just the rabbi or the clergy.
Yep.
Should be helpful. A lot of times I just feel, and I'm seeing there, I don't have to have a degree. They just want to talk to somebody.
Yeah.
Like you say, have a friend. And anybody could be a friend.
Yeah.
You don't have to have a college degree to listen to somebody and just saying, yeah, it's a trouble, you're right.
Yeah.
So you mentioned earlier that a small percentage of violence in the society comes from people with mental health. Is the media magnifying this and making it seem like it's a higher percentage, and not just the news media, but TV shows like Law and Order SVU or other types of TV shows, crime shows? Are they magnifying this and making it and scaring, and people are saying, wait a minute?
Yeah, Mark, you hit it right on the head. I mean, it does become that way, and it's so unfortunate that sort of that media portrayal of someone with a mental. One in 5 people in this country have a mental health related issue.
Really, that
That's
many?
1 in 5, and
I thought it was everyone.
Yeah, well, we all have our Mishigas, as you say,
right.
but 1 in 5, and so are we saying that 20% of the population is going to go out and do something violent or crazy or something like that? But it's such a small, incredibly small percentage, and yet that does get blown up, and that's why people don't seek treatment, because they'll say, well, wait a second, I don't want to be, I'm a person who suffers from depression or bipolar, whatever, or it could be anxiety, whatever it is, but I'm certainly not going to go public. I'm certainly not going to go public about it, because look how this, I don't want to be portrayed as some monster who's pushing people on subway trains.
They ask you, about your mental. They ask in a tactful way about mental illness on an employment form before you apply. And if you, they figure it out, and then you, by the time, if they have someone who doesn't have a history of mental illness, and someone who does, they're going to choose the one who doesn't.
Right. I mean, it's subtle discrimination. There's blatant discrimination that we see, and then there's that, as you said, there's kind of the subtle discrimination as well. This is
there's other problems also that, again, a little bit, because I have seen it. I'm not officially any psychologist or mental health professional. I'm a rabbi, but people, like I say, come for help. And alcoholism. And I mean, that's a big thing. First of all, it's legal. And then the marijuana.
Well, alcoholism isn't, but alcohol.
Alcoholism, I'm sorry. And marijuana, which is a big issue, current event issue. You legalize it, don't legalize it, to state, not state. And I mean, I'm against it because I see, people give me it back. I'm just telling you the argument that people, I says, I'm against it because I see it ruins lives. Then they'll say, well, alcohol is legal, and that also is ruining people's lives. I really don't have an answer against it. They're right, but...
Are you, as the Mental Health Association, in favor of legalizing marijuana?
We have not taken an official position. I think, that's one of those, and we try to be strong on positions, but I think that's one of those ones that has gone both ways, frankly.
And
I
not
think
for
there
medical
are people,
use. I'm talking about even recreational.
I think that, there are enough studies that have shown that marijuana is a depressant, and it's just going to make things worse for people.
It really does?
In some ways. For some people, it can make people more depressed.
Well, like alcohol is a depressant.
Right,
also.
it can make people more depressed. But on the other hand, when you're in so much pain, and if marijuana is in any way going to, in any way, shape, or form, going to help with your anxiety or help with, some sort of physical pain that manifests itself because of your mental illness, because we know there's so many people who have a mental health related issue who also have physical issues as well. So it's a tough issue. I think, it's hard to say where at the end of the day we'll end up, but it's certainly something we've been discussing, because I can see the pros and cons of both.
I was on the Taconic listening to WPDH radio, and it's a music station.
Right.
But they do take call-ins, and they want people to chit-chat.
Right.
So this guy called in from Monticello. It's 11 o'clock in the morning. He says he's been up since 4 o'clock drinking.
Yeah.
And he sounded it. You know,
Yeah.
he was really wasted. But, you know,
Yeah.
there are people out there who are, you know, just drinking their lives away.
That's so sad.
Yeah.
It is sad. I mean, and that's one of those sort of, I don't think the statistics really mirror because, you know, I really think that the issues of alcoholism, substance abuse are much worse than I think that, you know, than the statistics portray. I really do.
Because it would mirror mental health, mental illness.
Well, some people try. I mean, it's hard. It's always sort of a chicken and egg kind of argument. You know, are you drinking because you have a mental illness, because you're depressed, or are you drinking and then, you know, all of a sudden, you know, you have a substance abuse or alcohol abuse, and then after you're drinking and all that, then you become depressed. It's sort of like, you know, are you self-medicating, or are you doing this in a different way? But one thing I did want to talk about was,
sure.
if you don't mind, is,
Yeah.
you know, when we were talking about, you know, stigma and fighting stigma, one of the bills we're really going to push forward in January, we're very excited about, is a mental health education bill in schools. You know, as we were talking about in the beginning, because of social media and because of all the life stressors, people are, you know, young people are, it's very difficult for a lot of young people to survive and move through in their lives. And the reality is that you could go from kindergarten through your senior year of high school and never hear words like depression, anxiety, suicide prevention. And yet we have a high percentage of kids who are impacted by this. And yet we have curriculums in schools related specifically to cancer prevention, which is wonderful. And obviously that's, who wouldn't be against cancer prevention? But the reality is that kids are going to be much more impacted by mental health related issues than they are going to be, you know, related to cancer screenings and cancer prevention, things like that.
I totally agree. I totally agree with you. You know, I just feel that in public school, yeah, math, 2 + 2 = 4, I know, et cetera, that they're learning, but just how to live a life, and then they're just left on their own saying, well, what you're saying is the mental health. How do I deal with depression? How do I deal with, you know, and a lot of kids, even in school, let alone after school, their boyfriend, girlfriend, that's really a big thing. And no one tells them how to deal with these disappointments in life.
It's true.
But they'll teach them math and biology. Fine, again, and no one's knocking it, like I
Right.
say. But I mean, just this idea of how to be a person.
But I wanted to talk to him about his mental health education bill.
All right.
Is this part of Common Core?
No, it's not part of Common Core right now. So what we're hoping for is that it becomes at least a part of the health curriculum. You know, that when you know, it could even be, you know, frankly, it could just be 2 or 3 days of it being part of a health curriculum. The health teachers.
At what grade level?
We're talking about middle school through senior year of high school. So that's
So
when
you're
it starts.
talking about grade 6 or
So grade 5 through senior year of high school is what we're really talking about.
So 7 years.
Right. So and it
Of
doesn't
a couple
have to
of
be,
days a year?
A couple of days a year. We're not talking about
Right.
like a full semester.
Sure, of course not.
You know, we're talking about 2, 3, 4 days a year of like the teacher, the health teacher is talking about and some schools already do it. I mean, it's voluntary. Some schools already do it. There are schools around the state who do it, and that could be part of. Ultimately, at the end of the day, if we ever got the bill passed and talk about curriculum, you could use the example of some of the schools districts that are doing it.
Right,
And frankly,
because-
they're seeing the efficacy of doing something like
Well,
this.
right now, it's an ad hoc thing, so
Right.
the learning curriculum is not uniform.
Right.
So everyone's learning something different in a different way and all that. So you'd want to make it uniform for
Well,
every
we certainly
place.
want, yeah.
But with, you know, everyone talking about over testing and over this, you know, having too much homework and
Right.
I mean, this might just compound that. I mean, you may find resistance.
Yeah, I mean, you know, probably at the end of the day, you know, there will be resistance. I mean, we're not naive.
Who
We
are
know
the
that
chairs of the two mental health?
The chair.
committees?
Well, it's the chairs of the education committees.
You really
would
wouldn't
be-
go through mental health?
Well, we work very closely with the mental health people, but because this is an education bill, it would go through the
Kathy
education
Nolan and
Senator
used to-
Marcelino.
Marcelino, right.
Marcelino,
Used
and
to
they
be
already have a
Flanagan,
bill. They already have a bill, a same as bill for the mental health education. So a little bit of our work
same
has
as
been
means it's the same language in the Senate and the Assembly.
Right.
So they don't pass two separate bills.
right. So we already have sort of a good head start. We have great mental hygiene chairs in the Senate, Senator Ort and Assemblywoman Gunther, who've really been real strong advocates for us.
Well, she's a nurse by
Right,
profession.
exactly.
So, yeah.
And she's a good friend, and she's, they're both very strong advocates. So I think what,
Well, you should tell her about
that we
this guy from Monticello who called into the
There you
radio
go.
show.
I'm sure she probably knows him. I mean, she knows everybody in the
She
district.
does, yeah.
I'm sure
So-
she knows him, knows everybody
But
in the district. Yeah,
so
but-
that's,
Yeah.
that's, is it going to cause, is there a financial impact?
We don't, at this point, probably there'll be something I want to.
Well, because that's at the bottom of the memo, is there a financial impact?
Right,
So-
right. So there will, at the end of the day, there will be some we don't know how much that will
Oh,
be,
okay.
but that's something we'll
But
have
the
to-
same as bill that you talked about, is that, so obviously something's been developed, so.
Right.
There should be
and
a
I-
price tag.
No, that's a good question. I don't know
Oh,
what the
okay.
price tag is. I
Okay.
don't know what they've done in terms of the
But
fiscal
it's
piece of
in
it.
a-
Can't be that much.
Well, in a $140 billion budget
Right.
with a B, it's not
$10,
going to.
$20,
Yeah.
bucks.
Bupkis, that's right. So I just want, that's just interesting how,
Yeah.
so what other bills are you going to be pushing?
Well, those are big bills. I mean, we're very, managed care is something that's very important to us because as we go, it's the different way of funding the system of care, and that in many ways is going to be something that's going to be very important to fight for. So we're trying to be on top of that because right now it's happening in New York City, managed care for people with mental health and other behavioral related issues. It's always been paid a different way, fee for service. Now we're doing managed care. It's a whole different mechanism.
Health insurance has to pay for certain.
Right. And now it's going to come to the rest of the state
But
in
what
July.
care do you want to manage?
Well,
I mean, how do
That's-
you manage mental illness?
right. So what we're saying in this is that there is, when you look at mental health related issues, okay, there's the traditional medical model,
Yeah.
which is around
Medication.
clinic services, which again, what we advocate for is, frankly, we advocate for a hybrid. We advocate for what works for an individual. Call it the recovery model, call it the medical model, call it whatever you want to call it. We just want people to get better. There's no cookie cutter way to get better. But a lot of the services we run and we work on are peer support. So somebody who's been having themselves have had a mental health issues has now been trained as a peer who can go out to the community and work with someone who right now is going through what they've gone through, and they can help them get better and provide case management services for them. And you have family engagement, and you have things like supported employment and supported education for people with mental health related issues. A lot of our young people go to college and they all of a sudden the mental illness manifests itself. It's 18, 19, 20.
I had a friend of
You know?
mine who couldn't handle it. He went to Stony Brook and had to be picked up, and and then he tried Yale, I think, even, and it was just a disaster.
Yeah.
And sometimes the stress brings
Well,
out,
that's what goes
develops
there.
that mental illness.
Goes back to the original idea that, I was just saying, in our society, there's an incredible amount of stress that I
Right.
think, that they didn't have 100 years ago. It's very
so-
paradoxical. On one hand, we have such conveniences.
Right,
Life should be so
exactly.
easy
Exactly.
and sit back.
Yeah.
And on the other hand, it's so stressful.
So I got to ask you, do you have recurring bills that year in and year out that you're just hoping there's the stars and the moon
Well-
line up and there's the right mixture of legislators and
That's what happens with the tax checkoff bill. That was a bill that had been floating around for many years.
Okay.
And this year, just lightning struck. Everything
there
was.
others?
What's that?
Are there others?
Well, the mental health education bill. This is the first time
Okay.
we have the same as, but we've had various forms of mental health education
Okay.
bill over the year.
But I'm
Their
talking about
medication related,
other than what we spoke about already,
yes,
are there
there's
any
things
other?
like step therapy bills that have been around for a while. Where basically step therapy is same as called as fail first. Basically, you try, a health plan. You have Medicaid. You're on a health plan. You have mental health related issues. You're on a certain formulary. You have to take a certain medication first and fail first on that medication. It'll be probably a generic medication versus a medication where that might have better efficacy for you. So we're always fighting on the step therapy bill around fail first and things like that.
Okay, so you have job security because this will never be resolved.
Well, there will never be. Yeah, you hope. Obviously, we pray. We see some really innovative things that have happened over the years. You see people getting better, but you still see
Right.
a lot of issues. You still see
It's
an
like
underfunded
whack-a-mole,
system.
you cure one thing and
I
another
know.
one
You still
rises.
see an underfunded system. You still see, as we talked about, the discrimination that still continues to exist for a lot of people.
So they
there's a
say
lot
the
of-
biggest, it just breaks my heart, but the biggest, the percentage of death is by teenagers is suicide.
Yeah.
Obviously your work is cut out for you. Glenn,
Yeah, well,
over
that's
here.
one of the reasons we want a mental health education bill.
Well, I'm
Yeah.
glad we're helping with you along with educating
Well,
the public here.
We
so
appreciate it. We appreciate both of your time very much.
thank you.
Yeah, keep on going, Glenn. You're doing the great work and helping a lot of people, and continue with good health.
Much
Thank you
success
very
to you.
much.
Continued
Thank you.
success. Yes.
Thank you very much.